Hello.
Hi.
Good afternoon. My name is Amy. I'll be the provider taking care of you today, okay? Before we start, I just want to make sure that I have the correct patient. So I'm going to have you tell me your first name, last name, and date of birth.
My name is Yaneli Feliz. My date of birth is July 30, 2008.
Okay, so we have the correct patient. Okay, are you in any pain?
No.
Okay, so before we start, I just want to make sure that your vitals are within normal limits. So I'm going to be taking some vitals, and afterwards we're going to do an assessment called on the head. We're going to inspect the head, eyes, ears, nose, and throat, okay? It shouldn't cause any pain, but if it does, just let me know, okay?
Okay.
Okay, so we're just going to take some vitals, and okay. So the patient's blood pressure, the blood pressure is 111 over 72, SpO2 is 99%, pulse rate 79, temperature 98.7, and no pain, you said, right?
Yeah.
Okay. So the patient also appears well nourished. She is awake, alert, oriented times 4, acting appropriate for her age and ethnicity. Okay. So we're gonna start with the head. Okay. All right, so I'm going to be palpating and inspecting your head, okay? Just making sure that there's no lesion, no masses, no bumps, no lumps, no anything, okay? All right, so I am feeling the head right now. I don't feel no bumps, no lumps, no abnormal masses. The shape is round. I don't feel no tenderness. Her hair is evenly distributed, shiny, and no infestations noted. Her hair looks really shiny. We're gonna be checking your face now, okay? Okay, so I'm going to ask you to smile for me. Okay, perfect. Now I'm gonna ask you to frown, like if you're mad. Okay, perfect. And now you're gonna close your eyes as tight as you can, okay? Okay, tight. Okay, and don't let me open them, okay? Okay, perfect. You can open them. Okay, so her face is symmetrical. Her skin, I do see some bumps in the face. I do see like it's acne. Is that correct? Correct me if I'm wrong.
Yeah.
Okay. All right. Do you have any pain?
No.
Okay. So no abnormalities noted to face. No redness. No masses noted to face. Okay. So next we're gonna do a visual acuity test. Okay. Can you stand up for me? Called Snellen test. Okay. So you're gonna stand there for me? Okay. So with your both eyes, you're gonna repeat the letter when I'm pointing them, okay?
Okay.
Out loud, please.
E, F, P, T, O, Z, L, P, E, D, P, E, Z, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, E, E, F, F.
Okay. So the patient didn't say the letters right on the line where it says 20/20. So I'll give her for bilateral eyes, I'll give her a 20 over 25. Okay, so now you're gonna cover your right eye. Okay, and basically you're gonna tell me the letters as follows, okay?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, F, O, F,
Okay,
E.
you can stop. Okay, so the patient couldn't tell me the letters correctly for the 20/20 line, so I will give her a 20 over 25 for the left eye. Okay, now cover your left eye. Okay, so now tell me the letters, please.
E, F, P T O Z L P E D P E C F D E D F Z Z F.
Okay, stop. Okay, so for the patient, for the right eye, she got confused under the line where it says 20/30. So for that, I will give her a 20/40 for the right eye. Okay, can you please have a seat now? Okay, can you actually sit at the edge of the bed, please? We're gonna check next. We're gonna check your peripheral vision. Okay, so it's called a confrontation test. Okay, so basically, you're gonna look at me, and then you're gonna tell me when you no longer see my fingers. Okay.
I can't see your fingers.
You can't see?
I
Okay.
can't.
Okay, no problem. So the patient stopped here. She can no longer see my fingers at this distance. Okay, can you please lay back? Okay, so now we're gonna do what we called, we're gonna look for any extraocular movements. Basically, we're gonna do an H test, what's called an H test. So basically, you're just gonna follow my fingers. Do not move your head, okay?
Okay.
Look to the front. All right, and just follow my fingers. Follow my fingers. Okay, so now we're going to be checking your eyes. So I'm going to be checking for what we call a corneal light reflex. So I'm going to be pointing with a light at your eyes, okay? Okay. So just look at look at front and don't move, okay? Okay, so the right pupil is reactive to light and accommodation. It is equal, round, and like I said, it does react to accommodation. The sclera looks white. The conjunctiva looks pink and moist, and there's no lesions in the eye. Okay, so I'm going to be doing the left eye, okay? Okay, I'm sorry. So the left eye is actually reactive to light. It is round, reactive to light and accommodation. The sclera is also white. I can see that the conjunctiva is pink and moist, okay? No lesions noted to eye. Any blurriness?
No.
Okay, and the eyes are equally round and distributed. Okay, so now your lashes, let me check for your lashes now. Okay, they're equally distributed. Eyebrows are actually even and distributed. Okay, perla are within normal limits. Okay, so now we're going to be checking what we call, it's a test called cover on cover test. So basically what we're going to be checking is if there's any deviation coming from the eyes, okay?
Okay.
All right, so I'm just going to cover first your right eye. I need you to just look forward for me, okay? Okay, and then we're going to do the left eye. Okay, perfect. So there's no deviation going on, regular eye movements, and now we're going to check the fundus of the optic eyes. Okay? All right, open up. So we're going to inspect the right eye first. Okay, so red reflexes are present on the right eye. Okay, redness is present on the left eye. Okay. Optic discs are sharp, bilateral eyes, and there's no hemorrhage or any lesions noted to the eyes or any exudate. All right. So now we're going to be checking for the ears, okay? So first I'm going to check the outside of the ears, and then we're going to be checking the inside of the ears, okay?
Okay.
So I'm just going to be palpating. I'm so sorry about that. Okay, so there's no tenderness while touching. There's no bumps noted to ears. Ears are rounded and symmetrical. Do you have any pain?
No.
No? Okay. So now we're going to be checking for the ear canal, okay? So basically, I'm going to be checking the interior side of your ear with an otoscope, okay?
Okay.
So the right ear looks clear passages noted, no wax noted. The tympanic membrane is purely gray, and good light reflex. Now I'm going to be checking the other ear, okay? I'm just going to be going around. I'm so sorry. Let me see, just turn your head. Okay. Alright, so I see the ear canal for the left ear is clear, no wax present, tympanic membranes are purely gray, no redness noted, okay? Alright, do you have any pain in the ears, like in the inside? No?
No.
Okay, perfect. Okay, so now we're going to be checking for the outside of the nose, okay? So can you please sit at the edge of the bed for me, please?
Okay.
Okay, thank you. All right, perfect. All right, so I'm going to be checking the external side of your nose, okay? Can you please sit? Okay, so the nose is symmetrical, no deformities noted. Okay, do you have any pain when I touch you here? Any pain?
No.
No? Okay. Any pain here?
No.
Okay, now I'm going to be checking the inside of your nose, okay? Let me just get the otoscope. Alright, you just stay there. So sorry. Okay, so I'm going to be checking the inside of your nose, okay? Okay, so the nasal passages look clear. There is no polyps noted. The septum is straight. Do you have any pain when I touch? No? Okay. The linings are also pink and moist. And patient denies any pain. Okay. All right. So now what I'm going to do is you're going to cover one side of your nose, like one side, and then you're going to breathe in and out, okay? So
Okay.
cover the right side of your nose first, okay? And then breathe. Okay? Now do it on the other side. Okay, so do you feel any blockages going on? No? Can you breathe easily and unlabored? Can you feel breathe fine? Okay, perfect. So there's no blockages on the nasal, bilateral nasal canals, okay? So now I'm going to be checking your frontal sinuses and your maxillary sinuses, okay?
Okay.
Does it hurt?
No.
Does it hurt?
No.
Okay, so there's no tenderness. Patient reports no pain. Okay, so there's no no pain, no tenderness on the frontal or maxillary sinuses. Okay, so you can lay back for me. So now we're going to be checking for your so we're going to be checking on the inside of your mouth and the outside of your mouth. We're going to be checking for your gums. We're going to be checking for your teeth and your tongue. Okay.
Okay.
1 second. Okay. So we can see that the outside of her lips are pink. They are moist. Let me see. Can you open your mouth for me? Okay. All right. Give me 1 second. Okay. Show me your teeth. Show me your teeth. Okay. The teeth are present. Okay. Can you say? Let me see. Let me open your mouth again. The gums. Let me see the gums. Okay. So, Alright, so the gums, I can see that they're pink and moist. There's no bleeding going on. No bleeding going on the lips. No swelling going on the lips. Okay, can you please say ah for me? Okay, the uvula is present. It is pink. It's midline. Alright, I'm just going to help with this tongue depressor. Okay, can you stick out your tongue? Stick out your tongue. Okay, so I see the uvula present. Her mouth is pink and moist. You see no drainage, no redness, loaded to tonsils. Can you? Okay, teeth are intact. Okay, can you say ah? Ah. Okay. So the soft palate also rises evenly. Okay. Can you repeat this phrase after me? My name is.
My name is.
And just say your name.
Yaneli.
Janelle. Okay. And her voice is normal and normal tonification going on. Okay. Now we're going to test for your swallowing. Okay. So your swallow reflex. I had. Where's the cup? We had a cup. All right. So let's just swallow your own saliva because for some reason I thought I had water, but I don't. So just try to swallow. Okay. Do you have any pain when you swallow?
No.
Okay. Can you stick out your tongue for me? Open your mouth. Okay. Move your what's called your tongue to the left side. Okay. Move it to the right. Okay. Move it up and down. Okay. So we can see that the tongue is midline. It is strong and there is no deviation. And we just checked for the tongue movements and we were checking the cranial nerve number 12. Okay? All right. And the patient, we can also observe that she swallowed without any difficulty and no pain reported. Okay? So now we're going to check for the neck. Okay? Can you lift up your neck for me? Okay? So we can see that the neck is no discoloration going on with the neck. The neck is midline. There's no swelling noted. Is there any pain when I do this? No. Okay. No masses going on. Okay. You're gonna turn your head left. Turn your neck left. Now turn it right. Okay. Turn it up. Okay. And turn it down. All right. So she performed some range of motion. Any pain when you performed any of those tests?
No.
All right. So she denies any pain going on with the range of motion of the neck. I'm going to be checking your carotid arteries now. Okay. So I'm going to be checking the right carotid artery. Okay. So the carotid arteries on the right side of the neck is present. It is +2. Okay, now I'm going to be checking for the left side. Okay, so the carotid artery for the left side is palpable and it is +2. We are also going to check for auscultate. We're going to be auscultating the carotid pulse. So don't move, okay?
Okay.
So there is no abnormal sounds going on with the carotid arteries. No bruit heard upon auscultation. Okay?
I'm sorry. Could you say that in Spanish? I didn't understand.
It's okay. It's basically solamente te estoy explicando que no hay nada abnormal en el cuello y lo que yo escuché con mi estetoscopio no hay nada abnormal. So the patient basically was just asking me if I can give a brief explanation in Spanish, which I did. I basically explained that that the carotid arteries were present and palpable and no bruit going on. Okay? All right. Do you have any pain here? So I'm going to check for the thyroid now. Patient reports no pain. I don't see no masses, no tenderness. All right. Swallow for me. Okay. Do you have any pain when you swallow?
No.
Okay, so she swallows normally without any difficulty. Okay, so now we're going to be testing the respiratory and the cardiovascular systems, okay? So I'm just gonna look at, can you put yourself right there? Okay, cool. So I'm looking at the chest. The chest looks, I'm looking at the anterior and posterior part of the chest. They look equal. The rib cage looks below the thorax area. The patient is breathing even, easy, and unlabored. No signs of acute distress going on room air. Her breaths per minute are 18 breaths per minute on room air. I am going to now be hearing the lungs. So I'm just gonna have you breathe in and out, okay? Okay, so breathe in, breathe out. Okay, I'm gonna be inspecting the back. Listening at the back. Okay, so I need you to breathe in, breathe out. Okay, so lungs are cleared on all fields of anterior and posterior part of the lungs. No adventition sounds heard upon auscultation, no wheezing, no bronchi. Her chest is symmetrical. There's no signs of acute distress going on. Now I'm going to be testing for tactile I'm sorry, I can't pronounce this, tactile fermentis. So basically when you feel my hands, I need you to say 99, okay?
99, 99, 99, 99.
Okay, and I'm going to be doing the same thing in the front, okay?
99, 99, 99.
Okay.
99.
Okay, so I was able to do this test, and resonancy and symphony heard upon what's it called, upon testing, okay? Now I'm going to be percussing. I'm just going to do the same thing in the back, okay? Okay, so no dullness noted while I percuss the anterior and posterior part of the chest. If there was any dullness, that will indicate a fluid overload, which there was no fluid overload when I percussed, okay? All right, so now we're gonna go do, what's it called, what we call the cardiovascular system. So I need you to lay down. All right, so before that, I'm going to be palpating where the heart is, and you just let me know if you're in any pain, okay? Any pain? No? Pain? Okay. I'm going to be listening at the heart. Okay, so I'm going to be doing aortic, which is on the second intercostal space to the right. Pulmonic to the second intercostal space to the left. Herbs to the third intercostal space to the left. Tricuspid to the fourth intercostal space to the left. Mitral on the fifth intercostal space to the left. And then the PMI will be underneath the nipple on what's it called, on the left side of the breast area, which we can see once she raises up her hand in a minute, okay? I'm also going to be checking for the heart sounds. Okay, so no abnormal sounds heard upon auscultation of the heart. S1 and S2 heard upon auscultation. No murmurs, no gallops heard upon auscultation. Okay.
Are you having any pain at all when I do this? Okay. All right, so now what we're gonna do next, I'm going to be checking the jugular vein distension. So pretty much we're gonna be checking if there's any distension going on the veins on the neck. Okay, so I'm gonna palpate. Okay, and the carotid arteries are present on the left side. There's no jugular vein distension noted. If there was any jugular vein distension, that will indicate heart failure. Now I'm going to be palpating the carotid artery on the right side. So it's +2, palpable and present. I see no jugular vein distension going on the right side. No abnormalities going on, and the neck looks midline, the trachea looks midline, and she is in no acute distress. Next thing, what I'm going to be doing is checking for the arteries on the temporal area. Then I'll be doing carotid, I'll be doing abdominal aorta, I'll be doing the renal, the iliac, and then the femoral, and then checking extremities, okay? All right, so I'm going to do temporal arteries. They're present, palpable +2. All right, the carotid, I'm going to do one at a time. So it's present, palpable, and +2 on the left side. Carotid arteries present, palpable, +2 on the right side. All right, I'm going to first palpate for that aorta, the abdominal aorta. Then I'm going to do renal, iliac, femoral. I'm so sorry. And they're all present, palpable, and +2. So now I'm going to be auscultating. With the bell. So we're going to do the abdominal aorta first. Then we're going to be doing renal, iliac, femoral, okay? So they're all present, palpable. No bruit heard upon auscultation, and no thrill going on. Okay? Now I'm gonna have you sit at the edge of the bed again. I'm so sorry. Okay, so I am going to have you remove your socks. So I'm going to be checking for capillary refill on lower extremities as well as the hands, okay? So I apologize. Okay, so cap refill is less than 3 seconds on all toes of the lower feet, bilateral lower feet. Okay, now that I'm done down here, I'm going to be checking for the arteries. The posterior artery, dorsalis artery, the anterior and posterior are present, palpable, and +2. I'm going to be checking the popliteal, which is in the back of the legs. They're present, palpable, +2. I'm going to be checking for the radial arteries. They're present, palpable, +2. I'm going to be doing the ulnar arteries, present, palpable, +2. I'm going to be doing brachial, present, palpable, +2. I see no swelling going on, on the upper extremities. Skin color is even and appropriate for ethnicity. There is no cyanosis going on, no dusking, no signs of acute distress. I'm also going to be checking that in the lower legs. I see no swelling going on. The tone is appropriate. No bruising going on, no swelling, no hematomas, and yeah, no swelling going on. Okay, do you have any pain? No? No pain when I touch you? Okay, so that completes the video for respiratory and cardiovascular systems. I appreciate your time, and thank you for allowing me to take care of you today.